everybody has to be on that same bus going in the same direction. And if not, you'll not have any success with it.
Organization is using the strategy of employee engagement to really serve your hospital's mission in ways that you were, maybe doing it differently before. So really, I'd like to, have the group that we have gathered together and fans of the framework who are really committed people who want to inspire and equip positive change in healthcare. And I know that you have words and information to share with them. I'd like to have them hear maybe a little bit about your before story, about before you really embarked upon this strategy. What started making you think that, wow, we need to do something different in how we approach really engaging employees and leaders to contribute differently to our success?
Well, Denise and I talked about this, and kind of interestingly, before 2015, if you had come to talk to us, I think what we would have said was, well, gee, we're not really sure that things aren't going great.
Yeah.
We really didn't have a sense, I guess, that organizationally we had a problem. I think that what we did believe was that we had pockets inside departments that perhaps had some trouble.
Correct. Yeah.
And that, we tried to address those sorts of problems by doing those every 2-year employee engagement surveys. And then if something came up that we needed to address, then we would talk about those in town hall meetings, and we'd form little committees to try to tackle those small problems that we thought existed. But honestly, I don't know that we thought we had a problem.
That is so not unusual, Michelle and Denise, from, like when I look at across, the organizations that we've had the pleasure of assisting to create strategies like this and act on these strategies, is usually they're in 2 buckets. One is a bucket of hospitals or healthcare organizations that are struggling and need to create that strategy to overcome that struggle and prevent it from slipping into that struggle again. But then the other half are people that just see this amazing opportunity to take where they're at and just go higher. They're not really having these huge pain points, but they just realize that they see this opportunity and they just want to keep acting on those opportunities. And I think your organization is really one that fits into that fold of just always getting better and always looking for that next way to get better. So how is it better there now? I mean, even though you weren't in, can't contrast this huge difference between, ugly and beautiful.
Yeah.
How is it different today?
It is really, it's a lot different. And we didn't realize that there needed to be such difference. Employees are definitely engaged, but in a way that you see it. You see it when you walk in our hallways. You see it in how employees interact with each other and how they interact with the patients and all of our visitors. They make it such a point to speak to people in the halls and be kind to each other. And it's not that was a huge problem before. They were kind to each other, but not necessarily to people in the hall. They were focused on their job or focused on their next task. And so that is a very big difference. And we hear that from visitors that come to our hospital, how friendly our staff is and how caring our staff is. And that is very apparent.
Mm-hmm.
Yeah.
Well, I'll never forget whenever we first started this, and we started it really in earnest in May of 2016. And so, here we are 4.5 years into it, and you just can't believe the transformation. And it's so much more than staff engagement. But I'll never forget when we first started and you and Jane came on site, and I was so excited for you to come on site. But when you came on site, nobody talked to you. Nobody said hi to you. Nobody said, what are you doing here? Can we help you? And I know that I personally felt like, this was going to be a great way for us to introduce to you two what we had really done. And the truth was that it really had not even become loosely wired in any fashion. And I just remember almost being in tears because I was so
I remember
that our employees couldn't step up. And now, if you were to come into our organization today, I mean, that would not be at all what you would see. And I told Denise, I think that a lot of that employee engagement, if you will, and some of those little bundle tactics that we've implemented, like hallway etiquette and things like that, have just exploded. And it's made a difference in our physician recruiting. It's made a difference in our staff recruiting. It's made a difference in so many things, from our staff engagement scores on surveys to our HCAP surveys, even to our financial performance.
I know.
And so, it's just really, in 4.5 years, has truly been an incredible transformation. But I think more importantly, one we didn't even realize we needed.
I know. Yeah. It's like you were looking for an answer that you didn't even know you had a question or a problem for.
Exactly. Didn't even know the problem with. That's exactly right.
Yeah. I think that's what really makes you great leaders there, is that, not settling for, what you really thought was already really good, and saying, okay, no, how do we take it to that next level versus just deciding to settle.
Right.
One thing I was thinking about in preparation for our conversation is kind of, moving it forward to more recent, and certainly every healthcare organization right now is challenged in many ways related to the pandemic. And I know you guys are really serious about it, getting great results. I know you're very serious about serving your community and your mission. But when I was there, a few months ago during this pandemic, I know that seriousness and commitment you have. I know that, but what I really noticed too is you elude this confidence that we're gonna get through this, and we're gonna not just get through it. We are going to thrive in this.
Right.
And I was just blown away when I was in a room with your leaders, in the throes of this pandemic, and I felt that thriving confidence that we are going to serve our community through this like no other. Like, can you speak to what it feels like there right now, and why maybe you think that what you've done over the last 4.5 years has really prepared you, if you think, if that's a good way to say it, prepared you to really take on something as unexpected as this?
Yeah. And, I think it's kind of interesting, because even if you were to ask not just our leaders, but if you were to ask staff people who are really, really engaged in the work of the teams and engaged in this journey that we have, I think what they tell you is that had it not been for the work that we've done over the past 4 years, we would in no way have had the same response to this.
No. Not at all. And like Michelle said, we have employees and leaders that have repeatedly said that had we not been on this journey and really made ourselves good and strong, we would not have made it. We would have had a large amount of turnover, very disgruntled employees, but we have not. And doing a pulse survey in the midst of all of this, I know that Press Ganey was a little concerned, but we came out faring very well, even in a pandemic. And, in reading the responses on our senior leader and on leaders, how well everyone has come through all of this is just amazing. And to come in and see our staff, you would still see that it's a pandemic and we all are very stressed, but we help each other and we do the best we can communicating when things have to flip on a dime. And, this journey has really helped us prepare for that.
Yeah. Sure. And I started to say, I don't think that it is just necessarily the staff engagement piece that has led us here. And again, we have worked so hard over the past 4.5 years, very, very hard. And I think that it is a culmination of building trust, And, you know, I've been here for a long time. I'm a local person and I've been here for a long time. So I had a few things I think that were already in my corner, if you will. But I think that, you know, our ability to very openly communicate, be very, very transparent in our communication. And Denise and I laugh and say, sometimes, you know, we're too transparent. We feel like we're saying too much.
Yes.
We've got to be quiet.
Am I?
But, you know, I think that transparent and open communication, that trusting in senior leaders, trusting that things are going to be okay, not micromanaging your employees, valuing that your department directors are in the right seat, on the right bus, going in the right direction. That, you know, when our leaders say that they need to talk to senior leaders about something, we know that it's a problem that they can't solve on their own. Mm-hmm. Otherwise, people have the freedom to do what is necessary to run their departments and run it in a good way, because the trust goes both ways. Mm-hmm. And so I think not only is it about staff engagement, but it's about so many of the other little things that you've implemented to allow you to get to this position. And, you know, I think just in general about the pandemic, people are tired, you know, people are worn out, people are frustrated. We've kind of had enough of the pandemic, but, you know, certainly that is not just something that you're experiencing here in Sullivan, Indiana.
Yes, yes, indeed. Indeed. You know, when you were speaking about, you know, the empowerment, I guess, you know, we're kind of talking about engagement, but it's really about the empowerment and the ownership of employees and leaders to solve problems at the lowest possible level, and not, not feel like they can't, you know, because they're really empowered and they take ownership of that. And, you know, in preparation, we asked, you know, what really are you seeing there? And you guys really spoke to positivity, friendliness, happiness, even sense of belonging and pride and all of that. And, you know, what I was thinking about that is, sometimes we can get so focused on the numbers, and, you know, and those are important too, because I'm one of those number peoples, and it's like, it's hard not to get into a level of leadership and not really focus on measurable results and impact. But I know that when we ask you, what are you most proud of? It's that really stuff you can't measure. That seems to be what you're most proud of.
I think that's true. But, you know, in the 4.5 years that we've been doing this, we've had a $2 million swing.
And that's important.
This year in a pandemic, we still ended up with a positive bottom line. And, you know, we look at each other and go, my God, you know, the first quarter was just, you might as well have just canceled it out. It was horrible. But then to be able to respond and end up with a profit at the end of the year, what would our year have looked like had it not been for a pandemic? Right. You know, this probably would have been our best year.
You were positioned for that. When I saw your goals for 2020 at the start of the year, you were positioning yourself for a huge growth year.
Yeah. And, you know, and I think, you know, it's interesting because our employees and our directors are disappointed in that. Yeah. You know, and everybody's going, well, you know, what's going to happen to our goals this year? What are we going to do about the goals? Because we know, had it not been for that second quarter, we would have blown this year out of the water. Yeah. So, you know, in the 4.5 years that we've been doing this, we've had a huge financial transformation. And if you were to look at our net income, I mean, it's just a steady rise over that. Now, you know, is it all journey related? No, some of it's people related too. You know, didn't have the right people in the right seat on the right bus. And that has been very important in our journey too. And, you know, I think, you know, we've lost some people over the past few years, but you know what? We're fine with that. Turnover is never a bad thing, especially if they're people that need to leave your organization because they don't contribute to the value of the journey. And we've had some senior leaders that applied to too over the course of those 4 years. And so, yeah, it's really been, just as I've said before, just an incredible transformation, really.
Fabulous to hear.
And the seat on the bus is something that Michelle brought back from our leadership summit with you all. And that's something that she drives always. Whenever she talks at orientation, she talks about that we are positive. We are here to do a great job to serve our community, to be kind to each other. And if this is not the place for you, if this is not how you are, then this isn't where you need to be. We have people in the right seat on the bus going in one direction. And she really hits that home quite often.
Mm-hmm.
Mm-hmm. You know, one thing I've also noticed about your organization is your effort to celebrate more your progress, your success. You know, surprisingly, we find with our partner organizations that, you know, grateful leadership is one of the 9 core, you know, leadership strategies that are part of this. And celebration, surprisingly, is one of the tough ones. And you had to stand up a special, you know, team around that because your organization, even though it was getting such great results and making such great progress, celebrating that was a challenge.
You know, I still don't think we did a very good job with it. And, you know, I know when Jane was on site this last time, she kind of had to re-steer our celebration team. And, you know, I think it's not because we don't recognize that we've done great things. It's just somebody needs to say, hey, Denise, you know, your turnover met your goal. What are you doing to celebrate that with everybody? And I think that we still have a long way. We still have a long way to go with that. And, you know, we've had, my gosh, even during this year, we've had so many things to celebrate. I mean, you know, we were notified this year that we received in 2019 the Press Ganey Guardian of Excellence Award in Staff Engagement. And that's just given to a very small percentage of people in the Press Ganey family. And, you know, I mean, that would have been something to celebrate. You know, I think we're going to hit a couple of our organizational goals for the year 2020 in spite of the pandemic. So yes, celebration, very important. Do we do it well? Not probably where we should be, but we're better. We're better.
I know you're better. Yeah. Yeah, you are better. You are better. Yeah. Denise, from an HR perspective, you know, what are you seeing? Like, you've been there, you know, kind of, you can contrast the before and after, the before, you know, the now of it. And, you know, what are you seeing as far as, you know, a recruitment advantage? Are you seeing a bigger, better applicant pool? Are you seeing, you know, what impact are you seeing from an HR perspective?
We are, I tell you what we have seen as of late is our employees are recruiting because they like working here. And we have had, especially in our OB department, OB nurses that work at another facility, PRN, that are bringing those nurses over here in a full-time or part-time status. We still have some work to do on the onboarding, and we just went through the capstone education on that, and we're ready to start on that. But our employees love working here, and they now like telling people they work here, because a long time ago that was scored very low on any of our surveys.
And whether
they're proud to say they work here, and that is reflected in our community. And that is reflected in the way people get along here as well. Makes a big difference.
Yeah, I love it.
Yeah.
How about a parting, you know, key question I like to end these sessions with is, you know, if there's a key message you could leave to others who are maybe struggling with employee engagement, or maybe not struggling but have opportunities like you do, you know, what words of wisdom would you give them to inspire them to keep going at a higher level for employee engagement and the benefits of it?
Well, I think the biggest thing, and I feel like I can say that just because of the seat that I sit in, is that I really, really believe that your senior leader, your CEO, has to be engaged in this work, that they need to see that there's some value in improving that staff engagement, because this whole journey is really a top-down initiative. And when we started this, I was the one who said, look, you know, I want to be the journey champion. I want to make sure that this gets rolled out in our organization. And, you know we're involved in an ACO, and we're very successful in an ACO. But I think part of the reason that we're successful in that ACO is, again, because the senior leader values that proposition and values the work that needs to be done there. And I just don't think that you can have success without buy-in from your senior leader. And Denise mentioned this a few minutes ago, you know, that we had attended a leadership summit before we ever started this journey. And I think you and maybe the CNO had gone one other time.
No.
And heard him talk. No.
Three of you together.
It was the three of us.
So the three of us went, CNO, CEO, HR director, and came back and said, gosh, we need to start doing some of this. Well, that was, you know, sort of easier said than done. But then really when we had that bad survey in 2015, we kind of put the brakes on and said, hey, listen, we've got to do something. And so the senior leader thing is really, really important. And I think also recognizing that everybody in the organization, CEO, senior leaders, definitely department directors, everybody has to be on that same bus going in the same direction. And if not, you'll not have any success with it. When either one of those things are not there, I think you could probably make little indentations of improvement, but I'm not sure that organizationally you can make the kind of improvements that you would really need to have to see this sort of transformation.
I agree.
Yeah.
Right. I mean, and I think how we did it, whenever we did decide to do it, we took those directors out of here and they went and they bought in. So when you have your top people bought in and then you get your mid-levels buy in, you are ready to go because they are going to sell it when they recognize there were tools they could use to make their employees better employees, to make their jobs easier. We were on fire when we left French Lick in 2015.
Yeah,
we were on fire.
And, you know, I don't know that we necessarily expected that. I mean, we expected to go, you know, do some training with our leaders and say, okay, you know, what can we do to bring this back? And instead it was like, hey, listen, this just isn't good enough for department directors. This is good enough for the entire organization. What are we going to do about it? And everybody was like, yeah, you know, we got to do something. We got to move this forward. And so, yeah, that's a really good point. It wasn't just senior leaders saying we've got to do this. It was senior leaders and our frontline department directors saying we've got to do this. So by the time we had done our retreat in 2015, everybody was sort of walking out of there hand in hand saying, yeah, you know, we've got to do something.
Yeah. Yeah. What about your employee teams? How have they been able to function during this time? And what contributions are you most proud of that they've been able to make?
Well, I think, you know, we have 6 teams now. Maybe we've got one centered on employees, one centered on patients, one for nursing. We added the patient safety team. We've added the celebration team, as you mentioned. We used to have a clinic team. We took that off the docket in 2020, but instead we've added a community team, and now Denise and a few others are working on a wellness team. So we've added a couple of new teams this year, which I think are going to be really great. But, you know, I think the two probably biggest teams in my opinion are employee and patient, because they have the heaviest lift, if you will, of all the teams. And they've just done phenomenal work from, you know, staff engagement, improving customer service, improving the quality of care, I think, you know, are probably just, if you looked at it from a 30,000 level view, I think are probably the things that I think are really phenomenal. And, you know, Denise pointed out, you know, it wasn't that we didn't celebrate things or that we didn't do administrative rounding or we didn't do town hall meetings with the CEO. We did those things. It's just that they, once we started the journey, just became more focused and more deliberate, I guess, in what we were doing. So, you know, we've really, and the people who are on teams obviously aren't just department directors. I mean, they're frontline staff, and lots of them are left over from when we started this, and they were specifically recruited. It's kind of like a March Madness draw, if you will, that we went out and we really sought out high performers to say, hey, we need you to be part of these teams. And they've pretty much stayed with them as well.
It's a great place to engage people. Usually, engagement is such a great ideal at all levels in your organization, but if there really isn't, highly purposed structures and places with them, really clearly knowing what their contributions can be, it's really hard to act on that ideal of engagement without a structure and very specific work to engage them in.
Yeah, and that's true, and I had told Denise, we were talking prior to this interview, I said, when I look back prior to 2015, maybe even before 2016, and I think of the hospital's business plan, it was really just a tool for us to identify the things that we were going to do every year. And we would share that with department directors and we'd share it with staff, but it never got on a communication board. We never asked people, what are you going to do to help us meet these various, and they weren't even organized in pillars. They were just sort of categories. And so we never asked people, how are you going to help us to move in these categories? And it really wasn't until we started doing the business planning around those 5 pillars, putting out organizational goals, putting out department director goals or departmental goals, that I can honestly say that our work was organized, that our work was very, very intentional. Our work was very, very directed. And, you can't go to a single department in our hospital now without finding a communication board, without finding the organizational goals posted, without finding departmental goals posted. And knowing that, if I reduce my turnover, then I may help with my hospital's finances and that sort of thing. And it just never really clicked in my head that that sort of format or that sort of communication would be necessary to empower people to be engaged in the work of the organization. But, over time, that's just become sort of, oh my God, why didn't you think of that before? Of course, that's the way that it works. But, I think that part of that engagement is that everybody has to understand where the organization is going, and everybody needs to be able to contribute to that forward path. And so, that's just one more thing that's happened as a result of this journey.
Yeah. And I think that gives an opportunity in one of those words that you guys use a lot is the pride, is that when people at the front line in particular have an opportunity to really make contributions towards the overall strategies of an organization versus, just, like focused on their day-to-day shift, and now they're focused on the future of an organization and they're contributing greatly to it. I mean, how much pride does that bring to an individual at any role in the organization when they know that when you're winning, they really had a hand in it. They weren't sitting on the bench.
Right. Well, and when we were talking too, right, when we came out with doing this, how employees can affect their departmental goals. I'll never forget, we were talking about this earlier as well, is the clinics looked at reducing overtime because their overtime was just outrageous. And that was their departmental goal. And I just remember just staff saying, okay, I got to get clocked out. I got to get clocked out. I'm on overtime. And they would always check on that. And then in our housekeeping department, people were calling in all the time. So one of their goals was to reduce call-ins, and they were on each other not to call in. And actually both of those departments hit their goals that year, but everybody moves that needle closer to the goals when everybody's working toward the same thing.
Right.
Mm-hmm.
Right. And
that creates a social contract, setting a goal together creates a social contract.
Yeah. And it's so that little thing, everybody on the same bus going in the same direction, making sure you're in the right seat, making sure that you're contributing overall to the health of the organization. Really,
well, it has been such a pleasure from where we sit, Jane and I here in Northern Michigan and in our company, to watch your organization transformed to the level it has, you know, because we too can contrast where you started and where you are now. And it's wonderful to know how amazing your organization is doing at all levels to be able to just keep going, even in a pandemic, just
Right.
keep shooting for the stars, even though it's harder than ever because of these challenges, not giving up on it. It's
Right.
been wonderful to watch.
Yeah. Well, thank you. Thank you. We
Yes.